Now, joining me on the phone line is Marte Villion. She is SA Federation for Mental Health spokesperson. Ma'am, thank you so much for joining us. Could you furnish us with the details surrounding the deaths of these mental patients, why they were transferred in the first place from what I understand was a government institution to NGOs?
Good afternoon. Yes, the Housing Department of Health said that they were going to be moving these psychiatric patients from the Life Esidimeni facilities to local NGOs because of they said it was part of the process of deinstitutionalization. Now, deinstitutionalization is part of the National Mental Health Policy Framework. It's a process which government is supposed to be undertaking to move patient care away from state hospitals, psychiatric hospitals, and into community-based NGOs so that patients can be part of their community and receive treatment in their community. So they said that the move was part of that. But at the same time, the money that they said that would be saved from cancelling the contract would be going to upscale mental health facilities. And the reality is that that is not something that we are seeing at the moment.
So the total number of these psychiatric patients that were transferred from the government institution to the private institution is 36. Is this the total number of the patients that died as well, or is there some survivors out of this number 36?
No, the patients that were transferred from the Life Esidimeni facilities to the NGOs is almost 2,000. It was a very large number. The 36 patients that have died are just a portion of that. But 36 people out of 2,000, that's a lot. It's completely unacceptable.
So where does the buck stop? Where is the problem? I mean, does it lie with the government institution, or did this unfortunate incident happen at the NGO? Who's responsible here?
Is that I think that a independent investigation needs to be done to find out exactly in each case what happened that led to the death of the patient. I think that we have to be careful. If it was a case of negligence from the NGOs, definitely they need to be held accountable. But I also think that the department has to take responsibility because the termination of the contract as well as the whole relocation process was their responsibility. And I heard the clip where the department spokesperson was saying that, the families had been consulted and they'd seen the NGOs and all of these things. That's simply not true. We have been in contact with family members who a lot of them didn't even know where their family members had been transferred to. They never saw the NGOs. They thought their family members had been lost. They went to visit them at Life Esidimeni, or they followed up on where their family were being relocated to, and they simply didn't know. So the department cannot say that it consulted with the family and that the families were all involved and knew which NGOs they were being moved to and what the situation was, because that simply isn't the truth.
Marta, thank you so much for your time and shedding some kind of light on this very unfortunate incident.
Very much.
SA Federation for Mental Health there, just giving us an update on the mental patients that passed away after being transferred from a government institution to an NGO. Of course, a probe has been initiated, and we'll be giving you the latest as soon as that materializes.